Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I want to talk about plantar fasciitis. I want to talk about it because the diagnosis of plantar fasciitis, or that term, all that means is inflammation of the plantar fascia, which is a very strong ligamentous tissue on the bottom of the foot that essentially forms your arch. And it's sort of thrown around like, oh, well, I have plantar fasciitis. It's kind of like saying you have tendonitis. We need to know why that's happening. And that reason of why plantar fasciitis is happening or why foot pain is happening is very different for different people. And so it's treated in the conventional medical model as if the cause is the same for everyone and that it's a localized pain that's coming from that area and not, or coming from tension in the calf muscle, which is true, or calf muscles, there's more than one, which is true to a degree, but it's typically a much more broader issue than just having tension in the calf muscles or pain directly where the pain is at. And so that's why I wanted to address it. In my practice, we take a holistic view of pain, and so we treat pain holistically. And what does that mean? Well, it means that we're going to look at all the possible reasons why you could be in pain and then rule them out one at a time and make sure that we've addressed the entire issue from the inside out. And so with plantar fascia or plantar fasciitis, if you are having plantar fasciitis or pain in the plantar fascia, or not arthritis, but inflammation in the plantar fascia in both feet, that most likely is a systemic problem, meaning it's an issue that is in your whole body. And 9 times out of 10, I find that those people have elevated triglyceride levels, which is a type of cholesterol. They typically have, and it can be normal while fasting, but very elevated when they're not fasting. And so in those situations, it's important to run multiple cholesterol panels, both while fasting and both while not fasting, to see, how high those triglycerides run when they're not fasting. Because if it's a little bit over, it's not a big deal, right? Because typically cholesterol is run while fasting. But if it's way over, that is a big deal. And so what happens when in certain ligaments and tendons, actually it happens in muscles too, but we don't really know that until later. So I'm not going to address that today. But what happens when you have high triglyceride levels circulating in the bloodstream is that your body doesn't know where to put it. It's extra fat in the bloodstream, typically because that person is a pre-diabetic or diabetic, and you have elevated glucose levels in the bloodstream, and so that glucose has nowhere to go because you're no longer responding to insulin the way that you should, and so it turns into a triglyceride, and then there's elevated triglycerides in the bloodstream, and those deposit lots of places, primarily the liver. That's why we get fatty liver disease, one of the reasons why we get fatty liver disease, but also in the tendons and ligaments. And for some reason, especially the plantar fascia and the Achilles tendon, typically can get fatty deposits. And what happens when fatty deposits go into a ligament or a tendon or fascia, then that creates inconsistency in the elasticity of that tissue. Meaning, so like if you have this rubber band and it works really well, stretching back and forth, right? That's what ligaments and tendons should do. Have a really nice, strong, uniform elasticity that comes and goes. Well, if you can imagine, if you start to put things in there that are no longer elastic, that have no elasticity whatsoever, like fat tissue, then there becomes an inability to stretch and shorten the way that it should. And when that happens, it can create pain and it can create this inflammation in that region. And so by and large, if you have plantar fasciitis, it's a mouthful, right? If you have plantar fasciitis on both feet, you need to get multiple different types of cholesterol tests run to make sure that your triglycerides are not elevated, 1, while you're fasting, or 2, while you're not fasting in high levels. I'm not going to go into ranges on this video. I'm happy to talk to you or run levels, if this is something that's going on with you. Please call my office if that's the case. I will share my information at the end. So the other thing why people would get plantar fasciitis on either one or both feet is because they have low back tension or low back instability. And so if you can imagine, by the time you get down to the bottom of the foot, your line of tension is coming all the way up, maybe even from the neck, honestly. But typically it's the low back. And so if the person gets therapy to, strengthen the low back, stretch the low back, massage, PT, chiropractic, yoga, really working to strengthen the weak muscles and stretch muscles that are tight, starting all the way up from the low back, glutes, IT band, TFL, tensor fascialis, a muscle that's attached to the IT band, and then hamstrings, quads, and stretching all the way from the back and the glutes all the way down to the calves and then the feet, then there's a strong likelihood that plantar fascia is going to start to improve. You can do these things like conventionally, they're like wear a boot at night, get a cortisone injection. Those are good. Well, I wouldn't say those are all good therapies. Those do work temporarily, but typically if the other upstream issue is not being addressed, then that issue will come back. So really important that if you're going to get a cortisone injection or if you're going to wear a boot, which is annoying and obviously better than having plantar fasciitis, but still like maybe disrupting your sleep, which is not good either, then you need to, go to PT and have those upper stream, go to PT, go to yoga, get acupuncture, get chiropractic, get those things way up in the low back and upper legs addressed as well as the lower legs. And then the other thing I would say is if you're not walking correctly, as in you're a pronator, or you're walking on the outsides of your feet, or your feet are tipping in as you're walking, as in your feet are unstable as you're walking, that puts a lot of extra strain on the plantar fascia. And so orthotics is a good thing to look into, or getting the appropriate shoe or tennis shoe for your foot. We're not all made the same. We all need different types of support for different places in our treatment. And so shoes are really important, and orthotics and the type of orthotic you get is really important if you are suffering from foot problems. So I just wanted to go into kind of all the reasons why you may have plantar fasciitis and how to treat it, because it's often really, the conventional medical model is tunnel vision towards that issue. And it can be, and typically is, a whole health problem, not a, my foot hurts, let's focus on the foot and the lower leg problem. It can go all the way up to the low back, and it can be related to elevated triglycerides, and all those things need to be treated so the plantar fasciitis never comes back and you're no longer dealing with that problem, because it's painful and it's irritating and it can take a long time to go away. And so, people, then you're not active, which then makes things even worse. And so, the typical treatments that I recommend for people with plantar fasciitis are, one, getting appropriate blood screening done to make sure everything looks good related to blood levels of things. Thyroid issues can play a part in this as well. And then making sure that your gait is good and you're walking correctly and you're in the right shoes, you're wearing the right orthotics, and that you are doing stretching and strengthening for the right muscle groups all the way from the low back down to your feet. And lastly, once those things are looked at and taken care of, prolotherapy and PRP are indicated. Regenerative injection therapy to the actual plantar fascia can be massively helpful to that region. But again, any type of injection therapy is a temporary fix if the other issues are not fixed first. And so I do prolotherapy and PRP for plantar fasciitis, and it's very effective once and if all the other issues have either been addressed or if it's not related to those things and it legitimately is a localized issue from previous trauma or some other more simplistic reasons. That can be a localized issue, but more times than not, it's not a localized issue, meaning it is more than just what's happening in that spot in the foot. So I hope that was informative for you. The other therapy that is amazing for plantar fasciitis, or at least helping to release tight muscles that are stubborn and not, being released by PT, massage, acupuncture, is trigger point injection therapy. Using trigger point injection therapy to release muscles from the low back, hamstrings, and calf muscles can release the plantar fascia really well, and that helps expedite improvement in people who are working on the other things that I mentioned in this video. If you have plantar fasciitis and it's been bothering you for a long time and you're just not getting results, or it comes and goes, it would be lovely to talk to you. My office phone number is 206-899-6000, or you can email us at info@healingpeak.com to set up an appointment. Please like, subscribe, and share on my video, and we'll see you next time.